I've been doing headache medicine now for over 40 years, and basically, I grew into it like many of us people who've been in it for a while. And over the course of my lifetime, I've been involved in the development of every major acute and preventative treatment for migraine, starting with the triptans, and now most recently Botox, and now the monoclonal antibodies. I think it's really important to know that patients with migraine will be taking medicines for a long time. And one of the questions we've always asked is, the patient continues to take the medicine for a long time, will any safety concerns show up that we did not see early on in the studies? This is a long-term extension of patients with episodic migraine from the placebo-controlled double-blind trial. First, we found out the patients did very well. If you look at some of the data, it's very surprising in the sense that many of the patients continued to have significant results that continued for the duration of the study. So, for example, if you look at 50%, 75%, and 100% reduction in migraine days, 65.7% compared to 69.3 in the last 4 weeks. Half of the patients, almost half of the patients, had a 75% reduction, and almost 35%, actually all 36%, had a no pain in the last 4 weeks. So this is extremely important information. So we actually showed that. Now the other question we're going to ask about is, what about adverse events? And basically speaking, we had 100 patient years, and there were 123 adverse events. Nasopharyngitis was the most common, but upper respiratory infection, but that's very common in anybody if they're on a drug for 5 years. Those are most frequent. Significant adverse events occurred in 49 patients, and basically most were single occurrences. Remember, in a clinical trial, if you get hit by a car while you're on a medicine, that's considered a significant adverse event. There are 2 fatal events reported. One patient had atherosclerosis and death of unknown cause, and an autopsy was not performed. These were previously reported. The safety signals were consistent with those observed in the earlier trials, without increases over the 5 years. So this really tells us the following. Some of our concerns about continuing the medication a long period of time have been delayed, because up to 5 years, we did not see anything that we didn't see earlier. Patients were 5 years older, and despite the aging process, there were no significant increased adverse events demonstrated in our trial. That 383 patients were enrolled in the open label phase, and then after a mean of 2 years, patients all got a higher dose to 140 milligrams, and 132 patients discontinued Erenumab prior to the dose increase, and 35 discontinued Erenumab treatment while receiving the higher dose. People will stop for a lot of reasons. It's been my experience. There are a number of people in the antibodies, their headaches go away. Remember, this was an episodic headache population, episodic migraine population. And it's quite conceivable that the passage of time that may not have needed the drug anymore, because none of the discontinuations were actually related to the fact they had significant adverse events. Many patients discontinued treatment when there was a protocol amendment requiring a switch to a higher dose. If you look at other trials, like some of the anti-epileptic drugs, much higher withdrawal rate. The discontinued rates due to adverse events was low. 5% of those discontinued over 5 years, which is much lower than any other thing. So we know that patients discontinue for reasons other than adverse events. The trend of blood pressure increase, about 2 to 3 millimeters of mercury over 5 years, is very similar to the increased blood pressure with age that reported in the Framingham study. So basically, if we look at everything and what's happening, but we find it's really consistent with what's going on. The other point I would point out is that in the double-blind controlled constipation noted, the rates of constipation in this analysis was 1.8 per 100 patient years or lower in those in double-blind study. This is consistent observation. Constipation occurs early and tends to dissipate over time.